Clavicle pectoral fascia. It is a fascia which you will find between clavicle bone and the pectoralis minor muscle. It is pierced by some structures and coming as questions. So where do I see clavipectoral fascia? It is between the clavicle bone and the pectoralis minor muscle. Oh, that is where we have clavipectoral fascia? Yes. Let us look at the details now. You see, this is the clavicle bone. Yes. And then you see there is a pectoralis minor muscle. You know, where is the pectoralis minor muscle coming from? It is coming from the rib number 3, 4, 5. That is the origin. If you say the origin is rib number 3 and rib number 4 and rib number 5, then where is the insertion? It is the superior surface of the coracoid process, superior surface of the coracoid process. So coming to the superior surface of the coracoid process is the pectoralis minor, yes. And this pectoralis minor muscle between the clavicle and pectoralis minor muscle is a fascia, and that fascia we are talking about here, and this is called as the clavicle pectoral fascia. Now this clavicle pectoral fascia, which is between clavicle bone and pectoralis minor muscle, is also continuing downward towards the floor of the axilla. It will actually fuse with the floor of the axilla. There is some axillary fascia. So it will continue down towards the floor of the axilla, merge with the axillary fascia. Actually, it is enclosing this muscle. It will come and split and close the pectoralis minor and continue downward like that. So pectoralis minor muscle is split and enclosed by the clavipectoral fascia, which is continuing inferiorly then. Yes, we'll have one more diagram for that. But at this moment, you have to understand that what are the structures which are piercing the clavicle pectoral fascia. Let us magnify the diagram. As you are magnifying the diagram, you will find that there are some structures which are piercing the clavicle pectoral fascia. And who are they? You will see that there is this vein. And what is this vein? This is cephalic vein which is coming from here, and then it has to puncture the clavicle pectoral fascia to enter the axillary vein which is in the axilla. So this is the axillary vein which is in the axilla. Yeah, that is axillary vein which is in the axilla. And to enter the axillary vein, this vein has come. Which vein has come? It is actually coming from the lateral side, cephalic vein. It will puncture the clavicle pectoral fascia to enter the axillary vein in the axilla. So it is puncturing the clavipectoral fascia. Yes. And who else is puncturing it? Let us see. As you are talking about the structure piercing the clavipectoral fascia, you will find that there is one artery also. And what artery is that? You will find there is one artery and one nerve which is piercing the clavipectoral fascia. There is some lymphatics also piercing. So lymphatics are there, artery, nerve. Which artery and which nerve? Actually, you will see the nerve is called as the lateral pectoral nerve, supplying the pectoral muscle and artery. Artery is the pectoral branch of the thoracoacromial artery. Thoracoacromial artery is a branch of the axillary artery given in the axilla. So thoracoacromial artery is a branch of the axillary artery in the axilla. It is coming out now. Yes. Remember the various structures piercing clavipectoral fascia, and let us revise them again. There is a neurovascular bundle. Neurovascular bundle means nerve, artery, vein, and lymphatics. Yes. Let us revise them now. You are looking at a sagittal section at the level. So we are looking at a sagittal section at mid-sagittal or parasagittal. No, it will be parasagittal section. So when you have taken this parasagittal section, what did you see? This. What is this? What we find is some details like you will have. Most anterior will be some skin. Deeper to that is pectoralis major. Deeper to that will be pectoralis minor. And we want to look at the pectoralis minor, which is enclosed by the clavicle pectoral fascia. Oh, from the sagittal view? Yes, sagittal view. Let us see this sagittal view now. And what are you looking at? This is the clavicle bone. If you say this is the clavicle bone, fine. What is clavicle bone doing? Actually, under the clavicle, you have a muscle which is called as the subclavius muscle. Under the clavicle, that is why subclavius muscle. And then this is the pectoralis minor muscle which we are talking about. Oh, pectoralis minor covered by pectoralis major. Yes, that is the pectoralis major which is anterior. So anteriorly you have the pectoralis major and deeply is pectoralis minor, both of them forming anterior wall of axilla. Yes, anterior wall of axilla. And what is next thing? Next thing you have to understand, there was some investing layer of deep cervical fascia and splitting now to enclose, not enclose, it is attaching to clavicle bone, but inferiorly. Continuation of that fascia, you can say clavicle pectoral fascia, splitting to enclose subclavius muscle. Now clavicle pectoral fascia called so because between clavicle and pectoralis minor muscle is splitting and closing the pectoralis minor muscle and then fusing again, and then it is fixing with the floor of the axilla. When it is fixing with the floor of axilla, then it is here it is called suspensory ligaments of the axilla and attaching to the axillary fascia at the floor of the axilla. This is one diagram which we have to discuss now. So you want to see this fascia which is called clavipectoral fascia between clavicle bone and pectoralis minor muscle. Yes, it is pierced by some structures. We want to see them. So what are the structure piercing? Actually, there are some structures like the artery, nerve, and vein and lymphatics also. Which artery? You see, this is the axillary artery in the axilla giving the thoracoacromial artery, and it is piercing the clavipectoral fascia. And what are the vein? Actually, there is a cephalic vein which will be piercing clavipectoral fascia to enter the axillary vein in the axilla. And what nerve came out? There is a brachial plexus, and in the brachial plexus there was this lateral cord of brachial plexus, and lateral cord of brachial plexus gave a branch which is called lateral pectoral nerve. So you're telling lateral pectoral nerve come from the lateral cord of brachial plexus? Yes, medial cord come from the medial pectoral nerve come from the medial cord of brachial plexus. So lateral cord of brachial plexus give the lateral pectoral nerve which is piercing the clavipectoral fascia here. Yes, and you are telling there is some other nerve which is medial pectoral nerve given by medial cord of brachial plexus. Yes, medial, lateral. So this is lateral cord of brachial plexus giving lateral pectoral nerve. It is piercing clavipectoral fascia. Some lymphatics are also piercing. Yes. Okay, what is this? It is a downward extension of the clavipectoral fascia to attach to the floor of the axilla, and it is axillary fascia. This continuation of the clavipectoral fascia downward is called suspensory ligament of axilla and will help us to pull the skin of the axilla at the base of axilla upwards. But why would you pull the skin at the base of axilla upwards? Just to keep the content of the axilla secure. You just want to secure the content of axilla. So you want to pull the skin at the floor of the axilla just to secure some structure which are inside the axilla? Yes, just pull it upwards by suspensory ligament of axilla, continuation of clavipectoral fascia.